Hello everyone, welcome to Yellow Pages Nursing. In today's video, we will be discussing about transmission-based precautions. Before entering into the session, if you have not subscribed our channel, please subscribe our channel and do not forget to hit the bell icon to receive instant notifications. The learning objectives we will be discussing in this session are airborne, droplet, and contact precautions. Let's get into the session. Airborne refers to something that is carried or transmitted through the air, which means we can catch some diseases simply by breathing. Now, what is airborne transmission? Airborne transmission is a mode of disease transmission in which infectious agents such as bacteria or viruses are spread through small respiratory droplets that remain suspended in the air and can be inhaled by others. Here comes size of airborne particles. Respiratory droplets are of various sizes as shown in the picture. Factors that contribute to the generation of airborne particles are smaller droplets called droplet nuclei or aerosols, which are less than 5 micrometers or micron in diameter, can remain suspended in the air for longer periods and can be inhaled by others. Aerosols are even smaller and can travel over longer distances and reach deeper into the respiratory system when inhaled. Larger droplets, which are greater than 5 micrometers or micron in diameter, tend to quickly fall to the ground or surfaces within a short distance from the person. Now, let's discuss factors which contribute to the generation of airborne particles one by one. First comes respiratory activities. When an infected person coughs, sneezes, talks, sings, or breathes heavily, they release respiratory droplets of various sizes into the air. As discussed before, larger droplets quickly fall to the ground or surfaces, but smaller droplets can remain suspended in the air for longer periods. These smaller droplets, known as droplet nuclei or aerosols, can contain infectious agents and be inhaled by individuals in close proximity. The next factor is environmental factors. Environmental factors play a major role in the generation of airborne particles. Poor ventilation, stagnant air, or crowded indoor spaces can lead to the accumulation of infectious particles and increase the risk of airborne transmission. The next factor is aerosol generating procedures. For example, intubation, bronchoscopy, nebulizer treatments, or high flow oxygen therapy. These procedures can produce a significant amount of aerosols, increasing the risk of airborne transmission to healthcare workers. Now, let's discuss about infectious diseases that are transmitted through airborne routes. They include tuberculosis, measles, chickenpox, influenza, severe acute respiratory syndrome. Next, let's discuss some precautions which can prevent airborne transmissions. The first and the foremost thing is hand hygiene. Practice through hand hygiene before and after every patient contact using soap and water or an alcohol-based hand sanitizer. Next is personal protective equipment, that is PPE. This may include wearing a properly fitted N95 respirator or powered air purifying respirator. With a particulate respirator, perform a fit check before entering an area, along with gloves, gowns, and eye protection when caring for patients on airborne precautions. Gloves are used to protect hands from potential contamination. Gowns or protective clothing is to cover the body and prevent direct contact with infectious materials. Eye protection such as goggles or face shields to shield the eyes from respiratory droplets. The next main thing to prevent transmission is isolation rooms. Patients with diseases requiring airborne precautions should be placed in negative pressure ventilation room that help contain airborne particles. The negative pressure ventilation room helps to prevent the escape of airborne particles. The air inside the room is continuously filtered and exhausted to the outside, reducing the risk of transmission to others. Remember, these rooms should always be closed. The next important point is patient education. Educate patients about respiratory hygiene, including proper coughing and sneezing etiquette. Encourage them to cover their mouth and nose with a tissue or their elbow when coughing or sneezing, and to dispose of the tissues properly. The next main thing is to limit the transportation of patients from the room only for essential purposes. If transport is necessary, minimize patient dispersal of droplet nuclei by placing a surgical or procedural mask on the patient. Next is minimizing aerosol generating procedures whenever possible. If such procedures are necessary, follow appropriate infection control protocols to reduce the risk of transmission. The next important thing is proper disposal of infectious waste. Strict protocols for the disposal of infectious waste should be followed to prevent contamination and potential spread of airborne pathogens. It is important to note that the specific measures for airborne precautions can vary depending on the infectious diseases. Therefore, you can refer latest guidelines and recommendations from Center for Disease Control and Prevention or your own institutional policies.
Transmission. Droplet transmission is a mode of disease transmission in which infectious agents such as bacteria or viruses are spread through respiratory droplets expelled by an infected person. How are they expelled? They are expelled by an infected person when he or she coughs or sneezes, and these droplets can contain pathogens if the person is infected with a respiratory illness. If a person inhales or comes into direct contact with a respiratory droplet containing pathogen, the infectious agent can enter the respiratory tract through the mouth, nose, or eyes, potentially causing infection. Next comes factors contributing to the generation of droplet particles. First is respiratory activities. When an infected person coughs, sneezes, talks, sings, or breathes heavily, they release respiratory droplets of various sizes into the air. Next is environmental factors. Environmental factors play a role in the generation of droplet particles. Poor ventilation, stagnant air, or crowded indoor spaces can lead to the accumulation of infectious particles and increase the risk of droplet transmission. Next comes aerosol generating procedures. For example, intubation, bronchoscopy, nebulizer treatments, or high-flow oxygen therapy can produce a significant amount of aerosols, increasing the risk of droplet transmission to healthcare workers. Next comes size of the droplet particles. Smaller droplet, that is, droplet nuclei or aerosols less than 5 micron or micrometer in diameter can remain suspended in the air for longer periods, which are responsible for airborne transmission. Larger particles, which is 5 to 10 micron or micrometer in diameter, tend to quickly fall to the surfaces, and they are responsible for droplet transmission. Furthermore, these larger droplet particles travel a short distance and tend to fall to the surfaces within 6 feet or 2 meters. And hence, droplet transmission occurs when a person comes into closer contact with an infected person. Next comes infectious diseases transmitted through droplet routes. This include influenza or flu, common cold, pertussis, that is whooping cough, streptococcal pharyngitis, pneumococcal disease, mumps, etc. All these mentioned diseases spread through respiratory droplets when an infected person coughs, sneezes, or talks. Next comes droplet precautions. First is hand hygiene. Perform hand hygiene for at least 60 seconds or use an alcohol-based hand sanitizer. Follow the 5 golden moments of hand hygiene all the time. Next comes personal protective equipments. First comes surgical mask, which reduces the risk of inhaling the respiratory droplets. Next is eye protection. Goggles or face shield to protect the eyes from the droplets. Next is gloves. Gloves should be worn when there is a possibility of coming into contact with respiratory secretions or contaminated surfaces. Next is gown. Gown is worn when there is a risk of extensive contamination or when performing procedures that may generate splashes of respiratory secretions. Next comes patient education about respiratory hygiene or cough etiquette. Educate patients about respiratory hygiene, including proper coughing and sneezing etiquette. Encourage them to cover their mouth and nose with a tissue or their elbow when coughing or sneezing and to dispose of tissues properly. Next comes environmental cleaning. Frequently touched surfaces and patient care equipment should be cleaned and disinfected regularly using appropriate disinfectants as per the institutional policies. Next is patient placement. Patients with respiratory infections should be placed in private rooms whenever possible. If private rooms are not available, maintain a distance of at least 3 feet, that is 1 meter, between patients. Next is respiratory protection. For certain procedures that generate aerosols such as intubation or bronchoscopy, additional precautions, for example, N95 respirators or equivalent, may be necessary. Next is visitor restrictions. To minimize the risk of transmission, visitor restrictions may be implemented in healthcare facilities during outbreaks or when droplet precautions are in place. For further reference, you can refer CDC guidelines or your institutional policies. So here you go with droplet contact transmission refers to infection that is spread through direct or indirect contact with an infected person. There are 2 primary types of contact transmission: direct contact transmission and indirect contact transmission. Next, let's discuss how direct contact and indirect contact transmission occurs. First comes transmission through direct contact. This occurs when there is direct physical contact between an infected person and a susceptible individual. Pathogens can be transmitted through various forms of physical contact, that is, skin-to-skin contact, sexual contact, direct contact with body fluids, direct contact with respiratory droplets. Let's discuss it in detail. In skin-to-skin contact, what happens is pathogens can be transferred when the skin of an infected person comes into direct contact with the skin of a susceptible individual. For example, hugging, shaking hands, or touching. In sexual contact, certain sexually transmitted infections can be transmitted through sexual activity, including vaginal, anal, or oral sex. Examples include HIV, syphilis, herpes, gonorrhea, and chlamydia. Direct contact with body fluids, what happens is pathogens can be transmitted through direct contact with infected body fluids such as blood, saliva, urine, semen, vaginal secretions, or breast milk. This can occur through activities like sharing needles or syringes, breastfeeding, or exposure to contaminated blood or other body fluids. Direct contact with respiratory droplets. When an infected person coughs, sneezes, or talks, respiratory droplets containing pathogens can be directly transmitted to a susceptible individual who is in close proximity. Next, let's discuss Indirect contact transmission. Indirect contact transmission refers to the spread of infectious diseases through contact with contaminated surfaces, objects, or fomites rather than physical contact. Here, pathogens can be transmitted through various forms, including contaminated surfaces and objects, fomites, and indirect contact transmission. Let's discuss one by one in detail. Contaminated surfaces and objects. Here, pathogens can survive on surfaces or objects for varying periods depending on the specific pathogen and environmental conditions. When a susceptible individual touches a contaminated surface or object, they can acquire the pathogens and become infected if they then touch their face, mouth, nose, or eyes. Fomites. Fomites are inanimate objects or materials that can harbor infectious agents and serve as a source of transmission. Examples of fomites include doorknobs, countertops, toys, computer, keyboards, clothing, bedding, medical equipment, and shared items like utensils or towels. Common indirect contact transmission scenarios include healthcare settings. Here, contaminated medical equipments, surfaces, or hands or healthcare workers can transmit pathogens to patients or between patients. Community settings. Here, contaminated surfaces in public spaces such as handrails, elevator buttons, or shopping carts can contribute to the spread of infectious diseases. Here comes infectious diseases transmitted through contact transmission. They include methicillin-resistant Staphylococcus aureus, that is MRSA, vancomycin-resistant Enterococcus infection, that is VRE, scabies, impetigo, herpes simplex virus, human papilloma virus, that is HPV, sexually transmitted infections, hepatitis B and C infections, respiratory infections, etc. Next, let's discuss contact precautions. First comes hand hygiene. Next is personal protective equipments, PPE, that is mask, gloves, gowns, and eye protection. Next is patient education, respiratory hygiene or cough etiquette. Next comes environmental cleaning and disinfection. Let's discuss it one by one. Hand hygiene. Hand hygiene is the foundation of infection control. Nurses should perform hand washing with soap and water or use alcohol-based hand sanitizers before and after every patient contact, especially when there is a risk of contact with bodily fluids or contaminated surfaces. Next comes personal protective equipments. Gloves. Nurses should wear gloves when there is a risk of direct contact with bodily fluids, open wounds, or contaminated surfaces. Gloves should be changed between patient interactions and removed properly to prevent cross-contamination. Gowns. Gowns are worn to protect clothing and skin from contact with potentially infectious materials. Nurses should wear gowns when there is a risk of splashes or contamination of clothing with bodily fluids. Masks and eye protection. Depending on specific situation and infectious agents involved, nurses may need to wear masks and eye protection such as goggles or face shields to protect against respiratory droplets or splashes. Prioritize cleaning and disinfection of the rooms of patients on contact precautions, ensuring rooms are frequently cleaned and disinfected. For example, make sure it is cleaned daily or prior to use by another patient in case of outpatient setting. Also, focus on frequently touched surfaces and equipments in the immediate vicinity of the patient. Next contact precautions include patient placement and cohorting, limit transport and movement of the patients, use disposable or dedicated patient care equipments. Patient placement and cohorting includes placement of the patient, for example, the distance of separation between each patient,
privacy curtains between each patient in cohorting depending upon the conditions. Next is limit transport and movement of patients outside of the room to medically necessary purposes. When transport or movement is necessary, cover or contain the infected or colonized areas of the patient's body. Remove and dispose of contaminated personal protective equipments and perform hand hygiene prior to transporting patients on contact precautions. Make sure that you don clean personal protective equipment to handle the patients at the transport location. Next is use disposable or dedicated patient care equipment, for example, blood pressure cuffs. If common use of equipment for multiple patients is unavoidable, clean and disinfect such equipments before use on another patients. So these are all the contact precautions for direct and indirect contact transmissions. Now, let's take a few moments to discuss some of the important points in contact precautions. First and foremost comes the hand hygiene. Everyone, including healthcare workers and apart from healthcare workers, should follow proper hand hygiene whoever comes in contact with the patients. Hand hygiene is followed properly, keeping in mind the 5 golden moments. Next is wearing gloves. Put on the gloves before entering the room and as and when necessary. Why? Because all the procedure doesn't indicate wearing gloves. And once the procedure or the work is done, remove the gloves before you exit the room. Next comes gown. Like discussed before with the use of gloves, put on the gown before entering the room. Gowns are indicated in case of procedure which includes contact with bodily fluids or splashes. Make sure one gown is used for completing the procedure for one patient and it is discarded before we exit the room. Next is use dedicated or disposable equipments for the patients. That is, clean and disinfect reusable equipment before use on another patient. For example, while using stethoscopes, the diaphragm of the stethoscope can be cleaned by sanitizing swabs and then used for another patient. So far we have discussed about the contact transmission. What do we mean by contact transmission? And 2 types, that is direct and indirect contact transmission, the mode of transmission, the diseases spread through contact transmission, and contact precautions. So here you go with contact transmission and precautions. If you find this video useful, please like it, share it, and subscribe it, and do not forget to hit the bell icon to receive instant notifications. Thanks for watching and have a nice day.